Hello and welcome to today's episode of Talk on Things and Stuff. Now, in the past, we've gone over Representative Gary Click's introduction to the SAFE Act in Ohio. This was a bill aimed at putting safeguards around the surgical or medical intervention into children with gender dysphoria. It never went past the hearings that it held, but those hearings were really informative because there was a lot of debate with some expert witnesses, with some detransitioners, with some family members who had all interacted with kids with gender dysphoria. And I just thought it was really educational to see how those debates went. So if you have not caught up yet, you can watch part 1 and part 2 of Representative Gary Click's introduction to the bill and his Q&A session. It was a really informative session, and we're moving on today to witness testimony from the first case, Erin Brewer, who introduces herself as a detransitioner. And we will go ahead and dive right into that. Her testimony will be posted to the channel shortly after this episode, so you can just see it or refer to it or link to it directly. So we'll go ahead and put that up, and we'll just start watching and then pause if we have any reason to comment.
House Bill 454, also known as the Save Adolescents from Experimentation or SAFE Act, Families, Aging, and Human Services Committee. First hearing, February 17, 2022. Testimony by Erin Brewer, proponent.
The chair would like to now invite Erin Brewer to present testimony. Welcome to committee.
Thank you, Madam Chair. Thank you all for being here. Thank you, everybody in the room. This is a very difficult topic, as people have noted, and I'm here to address it from a very personal point of view. As a child, I was a transgender kid. I was insistent, persistent, and consistent. I hated myself as a girl, and I did everything I could to present as a boy. And I'm speaking about this today because there are thousands of parents and detransitioners who would like to speak out about this, but who can't because they're being bullied, or they're being told that they'll lose their job. They're being deplatformed. And so I'm speaking on their behalf and on my behalf as that little girl who was transgender, and so thankful that I wasn't put on puberty blockers to retard my growth and development. I wasn't put on cross-sex hormones that would permanently damage my body, with the combination of puberty blockers and cross-sex hormones that would have sterilized me. And yes, that combination, if given prepubescently, does result in sterility. I feel like I am called to speak for all of these detransitioners and parents because they are afraid to speak. And the fact that they're afraid to speak needs to tell us something. They're afraid to come up here and tell their authentic story of having been trans-identified and detransitioning and being bullied and being abused and losing their friends and losing their jobs and facing threats of violence.
So I think it's worth noting at the beginning of her testimony, this is a theme that you're going to hear multiple times as family members testify, which is there are adult women now who can recall that when they were kids, they experienced some dysphoria, or they were gender non-conforming, meaning that they had preferences or affinities that were not stereotypical for their birth gender. And because of the environment at the time, they were not immediately put on a pathway of affirmation. They had to learn to cope with their dysphoria, and over time, they were able to integrate their biological reality with their discomfort and mature and become the adult women that they are now. And I think having had that experience, when you listen to these witnesses, part of why they become very vocal about this is they look at what's happening to kids now. And specifically, they look at the irreversible changes, because now that they're adult women, they've also gone through those other milestones of having had children, having, learned the aspects of their natal biologic sex that they do like and that they are thankful for. And they see these interventions happening in children as foreclosing them into a particular way of being that prevents those opportunities. It prevents them from ever growing and maturing, in this case specifically into women. becoming mothers, breastfeeding, all of the other things that we'll hear from some of the other detransitioners. And so they look at what's happening to kids and they feel like this is wrong. There's something very troubling, because if I was a kid in today's environment, I would have been put on that pathway. And I think that's something really to contemplate, because it really puts into perspective the nature of the interventions that are going on. And so that's, I think, an important dimension to keep in mind. The second theme that she goes into is that she feels like she has to vocalize her experience, her objections, her concerns, because many of the parents themselves feel like they can't. And this is people might say, well, cancel culture is not really a real thing. You're exaggerating the cancel culture. And I think what a lot of parents are faced with is not so much cancel culture in the wider environment. It's a form of cancel culture within the confines of the home. And that is the ideas that go along with the social media notions of gender ideology, and where kids are getting, where they're learning about things like non-binary and all the different sexualities and all the different identities. It's usually on social media. And accompanying those new bits of information are also themes such as, if your parents don't accept you, if they don't go along with everything, well, then your parents are really abusive. And you may have to cut them out of your life. Oh, and by the way, we have a glitter family, a found family online that will take care of you and will address your needs. And you can just see us as your family. And so it's a way of creating division in the home. And so if the parents then are vocal about their concerns, they lose their connection with their child. Not because they're bad parents, not because they're abusive parents, but because their child has had these ideas about what constitutes abuse. And the positive aspects of cutting people out of your life, and the need to cut people out of your life. Those ideas have been planted in their head from social media. And you might say, well, that's ridiculous. Nobody does this. Well, I mean, you can learn. There's an extensive conversation with a detransitioner that you'll find on our channel under the Is It Culty series, where it looks at cult dynamics that exist in, some religious factions that we would say, oh yeah, that's definitely a cult. Things like Jonestown or Scientology. And when you look at this theme of cutting off family members that don't support you in your new way, it's really there. I think the one that really stands out the most to me is the garbage eaters. And there's a documentary in particular that's talking with the parents, and the parents have to be so careful about how they interact with their kids, because they may set their kids off and the kids disappear from their lives. And that fear really does exist in the homes that are dealing with this. The parents have to be very careful about what they say, have to be very careful about not confronting some of these things directly on, because it's going to trigger that defensive mechanism that may involve cutting their family out of their system. It's a really difficult position to be in. Okay, so let's keep going.
These are often children who, like me, were traumatized as children. The reason I developed a transgender identity is that I was sexually assaulted as a child. During that sexual assault, my brain came up with the idea that if I was a boy, that would never happen to me again. And that is why I decided I wasn't going to be a girl anymore. I hated myself. I hated what happened. And I was convinced the only way I could keep myself safe is to be a boy. And I'm not the only one. I've talked to hundreds of detransitioners who've had similar stories of sexual assault. I talked to my dear friend Billy Burley, who went through the full medical transition. And he finally realized his hatred for his penis that he had cut off was the result of a sexual assault by his swim coach. Now, when these kids come forward and they say they feel better when they transition, I am so sure they do. I am not discounting what they say. I'm not trying to erase their pain. I'm not trying to be hateful. I want to be compassionate and loving to these kids who are struggling with such intense feelings. These feelings of gender dysphoria are real. But rather than telling the child that they're inherently flawed and that they're born in the wrong body, and the only way that they can survive themselves is to basically kill who they are and become another person. That's a horrible message to give to any child.
Okay, this is a really important theme that is going to come up again, which is that uh, it, when you listen to detransitioners, as they've had time to reflect on their experience and kind of reassess all of the different steps that they took on their way to transition, it is not uncommon to learn that the complex history of the kids once they entered that affirmation pathway involved histories of abuse or histories of trauma. And because there's this gender identity that exists as they first interact with their therapist, and the therapists have taken on this idea that affirmation only is the best thing that they can do, then those underlying traumas don't get addressed. Instead, all of the attention is put on the gender identity, on getting the family to help them socially transition, on what are the next steps that we need to take in order to get to puberty blockers, to hormones, to surgery. And the idea that once you get through that transition, then all of these other difficulties that you may be experiencing that lead to depression or anxiety, all those other difficulties will resolve if we just do this intervention based on the affirmation. And so this underlying trauma never gets addressed. And it's a really difficult thing to confront because she's talking about this now when there's already the history of during the period of time where society was coming to terms with homosexuality, there was always this accusation that, oh, you're just gay because you were preyed upon as a child and somebody abused you and that messed you up and that's why you're gay. And so people conflate that messaging in the past dealing with sexual orientation, which does not have anything to do with gender ideology and gender identity. But because there's that history, people will point to witnesses who say, well, a lot of these kids have a history of sexual abuse and that's related to it. People say, well, you're just being as bigoted as those people who said that the only reason you're gay is because you were abused. And therefore, we need to shut down your hate and your bigotry and not consider that because that doesn't have anything to do with that. When the differences that exist between sexual orientation and gender identity, when you listen to the researchers like Stephen Levine and look at the different characteristics of it, as you know, the psychiatry and psychology profession learned, sexual orientation does not change. You know, when they went through all of those conversion therapy experiences thinking that they could change sexual orientation, the result of all of that was that they were not able, no intervention was found to be able to make a change in that. And the difference with sexual orientation and gender identity is that when you look at all of the kids that have gender dysphoria and you apply the watchful waiting paradigm, an overwhelming majority of them will resolve. They do resolve. That is the anticipated natural course of kids with gender dysphoria, is that they will resolve in a majority of cases. And that's very different from sexual orientation. Sexual orientation does not resolve with watchful waiting in a majority of cases. So there's something fundamentally different about those two, and you can't conflate them. The next aspect that she talks about is really believing that these kids are suffering. You know, some people may go so far as to say, oh, well, these kids are just making it up. They have their peer groups that are doing it. So it's not real suffering. It's just, they just want attention. And so that's what they're doing. And it may be really attractive to glibly put that framing around some of these kids that seem to be obnoxious if you're an adult and you're dealing with the way that teenagers deal with things. But I think if you listen to the therapists who have experience treating these kids that have this difficulty, people like Stephen Levine, they don't make that case. They acknowledge that the suffering is real. And I think if you're going to approach this issue, you have to start from that point. The suffering is real. Now, what causes that suffering, what could potentially resolve that suffering, that's all what we're trying to explore, what we're trying to understand. But you don't start by denying the reality of the issue itself. And the other dimension of that is that, yes, with the initial phases of hormones or surgery, there will be a period of euphoria where the kids have spent a lot of time wanting something and then finally achieving it, and they will feel like they've fulfilled a milestone. They've taken a brave step. and it will feel good. But the thing is, what mental health professionals are concerned about, the ones that are raising the alarm, is not short-term outcomes, it's long-term outcomes. And we'll hear reference eventually to things like the Swedish study that's looking at adults now, 30 years later, who, when they were kids, went through the hormones and the surgery transition. And when you look at the long-term survival curves of those, they fall off of the general population because of completed suicide, because the issues of depression, anxiety, dysphoria do not resolve even with those interventions. And in total, it's something like 19 to 20 times higher rates of completed suicide in those populations. And so anytime we hear some of the committee members push back against some of this narrative, saying that, the science shows that these kids are doing better, you have to step back and say, okay, well, what is that science? Is that because there was a study published that showed an improvement 18 months after intervention? That doesn't really paint the whole picture, because you really need to be looking at the long-term outcomes of these things. And you have to, look at exactly what they're measuring in that case. So let's continue with Erin Brewer's testimony.
Especially a child who's endured some kind of trauma like I did. Because if I had been given that message, I would have continued to believe that that sexual assault was my fault, and that the only way to stay safe is to be a boy. In addition, testosterone is a controlled substance, and it would make any single female in here, if we start taking it, feel like $1 million. We should not be giving children controlled substances, steroids, in order to make them feel better when they're struggling with mental health issues. It's a horrible disservice. We're basically encouraging them to dissociate, to run away from their feelings, to run away from themselves, and to take a drug that's going to, in the short term, help them to feel better, and in the long term, permanently damage their bodies, and in the long term, prevent them from getting the help that they need to understand the difficult feelings that they're having in the first place. I hear Dr. Liston and other doctors who talk about the medical expertise and the standards of care, and I want to acknowledge that, generally speaking, I have great respect for doctors. However, they have gotten it wrong in the past, and this is one of those instances where they're getting it wrong. And this has become a political ideology. It's almost akin to a state-sponsored religious belief that a child can somehow be born in the wrong body. That's a mystical view, not a medical view. And the idea...
Oh, that is such a good point on this. When you're considering this, and you examine the gender ideology, and people toss around the phrase gender ideology, and they say, well, that's just a buzzword that you're using to try to demonize people on the other side of this. But if you consider an ideology to be a connected system of beliefs that tries to explain some aspect of the world or an experience, then those beliefs may be true or they may be false. You can look at any system of beliefs characterized as an ideology and ask the question, are those beliefs true or are they false? And in this case, one of the fundamental aspects of the network of ideas around this issue is that there is somehow some intrinsic nature to each individual that has a gender. Some people have described it as there's this idea of a gendered soul, and that gendered soul occupies the physical body of the child, and if the physical body does not match the gendered soul, well, then the resolution for that is surgical or hormonal modification of the body. And when she says that's a metaphysical belief, that's because the idea of the gendered soul is not something that can be proven. There's no lab test. It's something that simply exists as a manifestations of emotions, of experiences and ideas. It's not something that is rooted in any sort of biological reality. And so, the different sides on this issue, one side may see it, as this metaphysical thing that's real, and so you have to intervene. On the other side will say, well, that sounds more like an aberration of thoughts, emotions, and ideas causing these negative feelings and dysphoria, and so we need to address the emotional, cognitive, and other psychological issues that underlie this distress rather than surgery or hormones, and that is going to be what's in the child's best interest in the long term. And I think that's really important to have as a background to this debate, because when she says it's a metaphysical claim that there's some sort of gendered spirit, then it's kind of like allowing one religious belief, one set of metaphysical beliefs to dominate the medical profession and to dictate to the medical profession how they should proceed. And that, along with this political dimension that she's mentioning, really makes it hard to approach medical subjects in an unbiased way that's keeping the health of patients in the long term at the center. And if you want to say, well, she's overstating the idea that it's a political issue, just look at what happens throughout these hearings, because you're going to see Democrats, independents, Republicans as witnesses. But when you look at the other side of the room, who the people in the committee hearing, the Democrats are all on the side of affirmation, and the Republicans are all on the side of, hold on now, let's be careful, let's put some safeguards up. And so that political division indicates to us that there is a political dimension to what's going on, and that should be a big red flag of, hold on, let's step back, let's take politics out of the picture and really look at what's happening here. So let's keep going.
That we should allow that child to, or encourage that child to engage in medical interventions puberty blockers, they block puberty. They're a developmental delay. They're retarding that child's growth and development. That's what they do. This is one of those instances, like the opioid epidemic, like thalidomide, like lobotomies, where doctors have gotten it terribly wrong, and where we have to stand up and put in some restrictions so that they can't keep providing this care to children when what these children really need is love and support. This is not about erasing transgender children. This is about providing them the care that they need.
Okay, so that point comes up as well. We talked about this in the discussion with Representative Click. Anytime you hear the phrase transgender children, you just need to say, hold on, put the brakes on. Which children are transgender? Because what we're talking about is not transgender children. We're talking about children who are experiencing dysphoria. And the reality that you have to face when you look at detransitioners, when you look at the natural course of children with dysphoria, which is that a large majority of them will resolve, then you have to confront the fact that you cannot tell which kids will have their gender dysphoria resolve and then will go on the pathway of an integrated adult that has resolved and come to terms with their natal biology, and which have persistence of dysphoria. So you cannot look at a child experiencing dysphoria and say you are a trans kid, because medicine does not have a way to distinguish which ones will resolve and which ones won't. And that fact is at the heart of all of the caution that is being put forth here. So it's good that she's bringing this out, because you can't say that the child in front of you is a trans child. That trans identity is a political identity, a philosophical identity that remains in the realm of adults who can make those decisions for themselves. But for the children, as we're trying to allow them to get to that adult phase, if you foreclose on that identity for them, and then add into that irreversible surgical and hormonal changes, which will significantly and seriously affect their futures, then you just have to be very, very careful about doing that. And the caution that's being raised here is important. The other thing that she mentions is that medicine has gotten it wrong in the past. And she brings up lobotomies and thalidomide treatments. And the thing is, when you go back and you look at those past, there's a period of time where both of those interventions were heavily touted. There were probably financial incentives for the surgeons that would perform the procedures, for the pharmaceutical companies that were making money off of the sale of the medications. But at some point, somebody had to say, hold on, step back, something's not right, let's take a look at this. And usually in the initial phases of somebody trying to urge caution, there's pushback. You know, why are you criticizing this? This is such a great thing. And it's only when more and more of those voices say we've got to look at the outcome, the long-term effects of what we're doing, and question ourselves as to whether it's right. And those voices are important because it's only through listening to those critical voices, seeing if their criticisms are valid, that the medical community is able to change course. And I believe that's the phase that we're at right now, is where more and more people are saying, let's re-examine the evidence base that has behind this. Let's re-examine the ethical principles that have guided us as we look at this. And let's look at those cases where things have gone wrong, because we need to learn from those lessons to see if what we're doing is right in the final analysis. Okay, so let's keep going.
This is anything but erasing them. This is the opposite of erasing them. Transing them is erasing them. If I had been transed, I wouldn't be here today as a woman and a mother and a wife and a daughter. I wouldn't even have my beautiful children. The fact that these children are going to have that choice taken away from them when they don't even have a sense of what it's like to be a grown-up is it's heartbreaking to me, and that's why I'm here. Not because I want to be here telling you my story, not because I want to be here talking about this kind of pain that I have, but to let you know that children are resilient and they can make it through these difficult feelings. They can survive whatever it is that's causing that dysphoria if they're supported, if they're not told they were born in the wrong body, if they're not encouraged to dissociate and become a different person. So I ask you, don't erase these children with gender dysphoria. Love them and support them and care for them. And I thank you so much, and I'm sorry for my emotional testimony.
Thank you very much for sharing your story with us today. Are there any questions?
Okay, so before we get to the Q&A session, we're just hearing a reiteration of that really important reflection that an adult woman has on the different pathway that her life would have taken if these irreversible interventions had been, imposed upon her as a child, experiencing discomfort with her own body because of a complex history of trauma and abuse. The Q&A session that we're about to go into is kind of where the real value of these testimony happens, because you can kind of see where people from both sides of this issue have their concerns and where the pushback exists. And so we're going to learn that. So before we get into that, let's take a look at some of the commentary from viewers. Susie Glucksman says, it's totally insane that we're telling kids, yes, you're right about your belief that your body is wrong. Let's cut it up. How this message is okay is beyond me. And this really is true. I mean, there's this philosophy when you read about the affirmation model of care. One of their principles is that kids know what's best for them, and that these teenagers and kids know who they really are. And so we need to trust, listen to them, and then immediately give them these interventions that have irreversible consequences for the rest of their life. And in what other context do you allow kids and teenagers, and you say you know what's best for you? Like, the whole point of having an age of consent and making sure that there's adults that are able to give a longer view and look out for the interests of these kids is because they don't have the sophistication cognitively to understand the implications. There's a great deal of impulsivity that characterizes teenage and adolescent life. All of these things mental health professionals will accept as real in any other context. But as soon as we get to this issue of gender, we throw all of that out the window and say kids know what's best for them. And that conflict, that disparity in issues should be one of the cognitive dissonance that mental health professionals say, wait a second, something is going on here. Why are we not considering, the fact that kids are malleable and fluid and they don't know exactly what they want and they're figuring out their own identity, which means that they're going to try on different identities and discard some and keep others. And it's that period of changing priorities. And unfortunately, with teenagers, it's also paired with a sense of urgency and certainty about every single time they try on a new identity. This is it. But then 2 weeks later, it's something different. And that's why you'll hear the gender dysphoria diagnosis, what used to be called gender identity disorder, all of those things. They have this idea that it needs to be persistent, consistent, and insistent for a long period of time. And when a lot of those diagnoses were in place, it was really looking at kids for whom these issues started when they were young children and they persisted for years into the teenage years, into the time where puberty was going to start to make changes that the clinicians felt like they needed to do something about. But that is, if you look at one of our more recent episodes, we talked about the different populations of patients that are interacting with these issues. You have the older middle-aged men, who are kind of make up the classic group of what were called transsexuals back at the time, and that's who predominantly would come to gender clinics. Then you have the small cohort of kids who, from a very young age, had this disconnect with their gender and their body. But then there's this new cohort, which is making up the overwhelming majority of who is going to the clinics today, and those are teenagers and adolescents and young adults who first encounter these ideas about gender through social media and peer groups and end up starting to experience gender dysphoria after never having experienced it as young kids. And it's a totally different patient population. And that's part of the reason why all of the things that people may think that they know from past research studies can't really be applied to these patients, because not only are they different in that the dysphoria is showing up as teenage years, but there's also all of these underlying conditions where over half of them have anxiety, depression, past history of trauma or sexual abuse or autism, and all of these different complex features which play a role into it. And when you look at the research, specifically the Dutch study that is being used to justify these hormonal and then surgical interventions, anyone with those complex characteristics was excluded from the protocol. And so we can't say that the things that they describe as a positive outcome from that protocol would also apply to these teenagers, because it's a totally different patient group. The nature of their discomfort is different. So yeah, and the message that your body is wrong is not allowing kids to mature into adults that are able to deal with difficulties and deal with issues. It's saying, okay, well, you've got a problem. We're going to solve it with medical and surgical intervention. And if nobody goes along with it, well, then you can problematize them and call them bigots and call them hateful. And it's just setting kids up for a way of dealing with difficulties that is going to create more problems in their life as they go through the challenges of life. Susie goes on to say the messaging about suicide is causing a moral panic in society at large. And the cruelest part of this is to tell children that they will commit suicide if we don't cut you up. And this is something that will come up again with detransitioners, where they will go to a therapist or arrive at a gender clinic after not really ever having experienced suicidality or thoughts of self-harm, but they'll hear the clinicians tell the parents, if you don't affirm, your child will likely kill themselves. And that creates an urgency in the mind of the parents. It sets the kids off on a different pathway of, fearing for themselves that if they don't get this, then they will eventually become suicidal. And it's a coercive paradigm to obtain consent that is really inconsistent with what we know about medical ethics, particularly when you look at things like the review of suicide among transgender kids that Michael Biggs out of Oxford have published, saying that when you look at the statistics, it does not bear out that there's any justifications for these clinicians telling parents that if they don't affirm their kids, they will likely commit suicide. It's true that among kids that present to these clinics, there is a higher rate of suicide, but you have to account for all of the underlying mental health issues, such as anxiety and depression, that coexist with this issue of gender dysphoria, because it could be that the gender dysphoria is causing the suicidality, but more likely it is that kids who already have a risk for suicidality because of underlying issues of depression, anxiety, prior trauma, and so forth, have found gender identity and this gender dysphoria as an expression of those underlying issues. And so that is why there's an association with suicidality. But even with that suicidality, where there may be thoughts or attempts at suicide, the actual completions of suicide remains very rare. Okay, so let's see. Law of improbability talks about the cruelty of false solutions. And that cruelty is compounded not only by the effects of these irreversible hormones and surgery, but because you're focusing so much on this one issue of gender identity, you're leaving untouched and unaddressed any other complexities of the child, whether it's past trauma, underlying sources of anxiety or depression, or things like autism or bipolar disorder or other mood disturbances. I think one of the concerns that you'll hear from Helen Joyce, when she first decided to look into this, she realized it's because not only do a lot of the kids that experience gender dysphoria resolve spontaneously, but there is a higher proportion of them that end up being homosexual adults. And so if you take that entire group and give them these hormones and these surgeries, which have the result of sterilizing them, then what you're doing is you're taking the group of kids who would most likely become gay adults and lesbian adults, and you're sterilizing them. And she realized that that is what is tacitly happening. And so this issue needs to be examined more closely. So targeting gay children from mass sterilization is an important dimension to this that you need to look at, because that may be the unintended consequence of how this intervention is happening. Wait until people wake up to this. It'll make the Catholic Church scandal look tame. And when you look at the number of kids that are undergoing these hormones and these surgeries, Chloe Cole, in her testimony in Florida last week, said that there's a coming tide, a coming epidemic of detransitioners, and we may see that. Okay. Let's see here. Uda Hagen says, thanks for featuring Erin Brewer. She's posting clips on her own channel and advocates Protecting Children channel. So I'll see if I can find the link to Erin's channel. She does have a YouTube channel where she's keeping people informed about where she has shared her story before various state committees, just to try to get the word out so that her experience can inform the people who are looking at shaping laws around this issue. All right, so let's go ahead now and move on to, well, I think this is an important fact. So I keep seeing the claim that puberty blockers only delay puberty and it can be resumed. And I think the false claim about the biological effect is a major contributing factor to the sense that it isn't harm. That is so true. Listening both in the Ohio hearings as well as where it's stated other places, people have put the branding of the pause button. And there's even a cartoon by some trans activists who they depict children playing video games, because that concept of a pause button makes sense to kids who are familiar with video games. You press pause and then everything stops. You can go get a drink, do whatever you need. And then whenever you're ready, you just resume again. And so there's this idea that this intervention of puberty blockers is just pressing pause. And what we're learning is, while that may sound appealing and it may seem like, okay, well, then we don't have to worry about irreversible changes, irreversible harm, or irreversible damage, that pause is not actually a pause. It's an intervention that has consequences. And it has consequences because there is a biological clock in your body that does involve the pituitary hormone axis that is affected by these puberty blockers, but involves other aspects of your body. And all of those things are supposed to work in harmony at the time of puberty. So changes like bone development and cognitive development happen at that time as you mature from a child into an adult. But disrupting one component of that with the puberty blockers doesn't stop every process. And so at that time, when this symphony of puberty is supposed to all happen at the same time, and you take out a whole group of instruments, well, then things are going to change. And we're only learning now that this has happened. And particularly in the Dutch experience, one of the reasons that they stopped it is that they had a teenager who had such weak bones that they started getting the type of compression fractures that you usually only see in like 70 to 80-year-old women who have bone loss as a result of menopause. And they realized that these puberty blockers are not the harmless pause button they are really causing problems. You have to forgive me, my dogs are barking. Okay, so so that's something to really keep in mind. So why don't we continue now with our Q&A session.
For the witness. Representative Liston?
Sure. Thank you, Chairwoman. And I'm sorry for what you have gone through. I read your story of abuse on your blogs, and obviously none of us believe that that is something anyone should go through, and our heart goes out to you for those experiences.
Okay, so we mentioned this before. Representative Liston is herself a pediatrician, and she will be one of the most vocal voices pushing back on the testimony here. But what she just said is that none of us want anyone to have gone through the experience of being sexually assaulted as a child, and that is an obvious statement. But that's not the point of Erin's testimony. The point of her testimony is a lot of these kids that are presenting with gender dysphoria have the dysphoria specifically because of traumatic experiences. And I think that really does bear out as you start to listen to detransitioners. And even if you say it's only the ones who are detransitioners now who express it, who have had that still is a significant portion of the patients, so that you need to incorporate that consideration into the analysis and assessment of these kids. And it's that exploratory therapy that needs to be an inherent part of how we approach kids who initially present with dysphoria. So we'll see if she discounts that reality and just says, well, it's bad that you had this experience, but we're going to push forward. Or if she says, that really is a reason to reflect and to cause the medical profession to reflect on what we're doing for these kids.
But I will say, you have quite the collection of media and books and videos about this experience, where you share the story and have very defined opinions related to, the transgender care. And I did watch a video that you did just maybe 2 weeks ago, 3 weeks ago, where your focus was the trans ideology is a state-sponsored cult. Mm-hmm. And I wanted to understand that perspective, because it's certainly not how I might view it.
Sure. And for those who don't know, I grew up as a staunch Democrat, a card-carrying member of the ACLU. I volunteered for Planned Parenthood. The reason I started getting involved in this is because I got a letter from Equality Utah as a donor. What really concerned me initially is talking to lots and lots of gay kids who felt like they were trans in order to trans the gay away. So the idea that a child can be born in the wrong body is a metaphysical idea. And for doctors to embrace that is indicative of a ideological or religious belief system rather than something based on fact and based on medicine. There is no litmus test. There's no diagnostic test other than the feelings of the child to diagnose somebody with gender dysphoria. And going that step further, as I said, I 100% believe in gender dysphoria. I know what it's like to have intense feelings of distress about being a girl. And I honor that in the same way that I honor people who have schizophrenia or bipolar disorder. These are profoundly difficult mental health issues. But as a society, the fact that, Representative Click said he's not afraid of information, he welcomes it. But the fact that as a society, we have systematically been quieting people who have these stories. I've been told, I don't deserve to talk because I was never really transgender because I detransitioned. I've been told that I must have internalized transphobia and that I'm really transgender. I just won't accept it. These are ideological belief systems. The fact that any doctor who stands up and says we're concerned about the way these medical interventions are being used is labeled a Christian conservative and dismissed. It's very similar to the kind of dismissal that happened during McCarthyism, where people with a certain ideology were shut down, were investigated, were deplatformed. Well, now that's what's happening with this. And it's Representative Click is a Christian pastor. I work with lots of feminists, lots of lesbians who are scared by this because they know that they would have been put on this path if they were children today, because they were gender nonconforming children. And rather than embracing these incredibly invasive and damaging interventions, why aren't we just saying it's okay to be gender nonconforming? Why are we giving kids the message that if they're gender nonconforming, there's something wrong with them? So wrong with them that they have to be medicalized. And that's where it feels so much more like an ideology, because when you look at how these standards of care have been pushed through, they're not generally accepted by the vast majority of physicians. It's small interest groups that have pushed these standards of care.
Follow up.
Okay, she did a phenomenal job in that answer, because she pointed out that that core belief about a gendered soul that can be mismatched with the biological reality of the physical body that then requires hormonal and surgical intervention, that is a metaphysical belief. It's not rooted in the same sort of objective, testable reality that all the other interventions that would lead to surgery or hormones has. And because it's a metaphysical belief, it's in the realm more of religions that are also based on metaphysical beliefs than not. But now that's just the one component of it, though, because if you say that it's a cult, well, then what are those things that characterize cults that we don't like? Well, things, when you go to a cult, you cannot question the beliefs. You cannot express doubt. You can't criticize the thought leaders, the leaders of the group. And then she starts to point out how the way that these beliefs are playing out in both the medical and the political environments are that you can't question. If you do question, you get the same sort of shunning and ostracism that you would expect to see in a cult. And she points that out brilliantly. She references things like the McCarthyism era, and that those are other instances where a strong ideological component infused into the political system affected the way that we did things. And so I think she's pointing out all of the right things that you need to kind of pay attention to realize that there is something that is both ideological and culty going on, because we're not free to discuss all the pros and cons without people injecting a moral vector into it, saying that because you said something critical, then you are a bad person, you are hateful, you are a bigot. And as soon as that moral component comes into how you respond to critics, then that's a red flag that there's something culty going on that you've got to pay attention to. So she did a great job with that answer, and we'll see how Representative Liston responds.
Okay, so just to boil it down, you're speaking from your own experience after abuse of gender dysphoria, and your understanding of conversations with the trans community in Utah, and that's sort of the platform that gives you sort of the background to speak about the issue.
Well, I think my own personal experience as a transgender child is huge, but
I just want to point out that what Representative Liston just did was to call into question the idea that Erin could even speak about this issue. And she did it in a passive way by saying, oh, so you think you spoke with some trans people and you have your own experience, therefore you're entitled to speak on this issue. And it's a way of trying to delegitimize her testimony, not by saying that her testimony was illegitimate, but by going after her character or her background by saying that, you know, she's taken some undue privilege to be able to come up and testify. And so anyway, that's, we spoke about in the first episodes how there's a way that Representative Liston approaches these things that does not rub some people well. And I kind of feel that a little bit in that last response, but let's keep going.
I've also, I've talked to many, many detransitioners. I've talked to many, many parents. I have parents who call me and they are just sobbing because they have children who, you know, 3 weeks ago were completely comfortable with their sex, who suddenly come home and say that they're the opposite sex and they want to get these medical interventions. So it started out me speaking about, sorry, I just realized I'm supposed to answer questions through you, Madam Chair. It started out with me speaking out because of my own personal experience. But as I've been in this, I've had detransitioner after detransitioner, parent after parent. I've even had mental health care providers reach out to me and say, I would love to be able to speak out publicly about this, but I will get fired if I do. My children will be harassed. My son was sitting at a bus stop when he was 14 years old, And somebody came up to him and said, I hope you know that the people in the LGBT community here in Logan want to kill you. That is not love and tolerance. That is not about medical interventions. That is an ideology that brings out hatred and abuse towards anybody who questions it. And again, this is coming from a position of wanting to, I want these kids to feel comfortable with who they are, to thrive. And they're not going to be able to do that if they're told they're inherently flawed and they're born in the wrong body.
Representative Click.
Thank you, Chair. And I think, first of all, thank you so much, Erin, for coming today. And I know it was hard for you to pour your heart out publicly like that. That's nothing that anyone is comfortable doing, and talking about your past that way. I really appreciate you taking the time. And I think it's important that we recognize that everyone has a right to speak, and we certainly do not want to shut down any opposition voices. And I'm very grateful.
So Click is, you can tell he's talking through Erin to Representative Liston. He's basically saying everyone has a right to speak. Like, for you to inject doubt as to whether or not Erin has any legitimacy speaking kind of goes against the whole concept of we want to hear from people about all different sides of this issue. And so I think that's some of the subtext of his initial response here.
I know we have some folks in here today who are opposed to this bill, and I'm very grateful for them being here and the respect that they've shown, and we plan to do the same thing when they give their testimonies. But in general, maybe outside in other places, are you telling me that you experience people who demonstrate hate towards you just for speaking up, just for sharing your story because it doesn't match their agenda?
Yeah, and that's why I say I'm here not just representing myself, but representing thousands of others. I work very closely with a woman whose son is still transgender identified, and she's afraid to speak out because her husband will lose his job. People have threatened me physically, said that they're going to hurt me if they ever come across me in the street. It's really hard speaking about this because there is so much hatred. I testified in Alabama a couple of years ago, and when I was walking out, the halls were lined with people who were against the bill, who were trans-identified, who were calling me cunt and bitch and trying to trip me, who threatened to kill Wire simply for telling a story. So again, this is why it feels so much more like an ideology than medical care.
That thing that she's mentioning where, there is this verbal abuse, physical abuse, and threats that are being hurled at people who are calling for safeguards, who are saying we need to change the way that medical care is affecting these kids' lives. Those things are there. They're real. They're being experienced. But then you have people who minimize or dismiss it. And so the individuals who end up showing up before these hearings and speaking out about it are taking a risk, because that is kind of a known variable in circles where people talk about this. They know that they're going to be faced with being called names, with being criticized. I'm active in the online community of former Mormons, and I've tried to post some of these things just in the places where former Mormons regularly discuss these things. And every time I post, I have significant pushback, and I've been called a hateful bigot. I've had people who previously liked and appreciated my commentary and analysis on the issue of Mormonism unfriend me and consider me a hateful bigot because I've started to look at this issue. And I found it to be important because there are people in the former Mormon community whose families are struggling with kids who have this issue. And when I started to see the same sort of ideological component show up around the discussion and discourse with this that would show up in religious circles around Mormonism, I thought that, there's something here that does require further investigation. And it was only after I kind of really tried to listen to all the different sides and see that there was something worth talking about here that I started to add that into the discourse in those former Mormon spaces. But I've seen the online equivalent of what she's talking about just happen in my own experience there. And so these things are real. And she's not saying that the resistance proves her wrong, but it proves that the issue is wrong. But it does show that there is an ideological component. And so you just need to step back and question yourself, is my position the result of a particular bias? And that's true, I think, on both sides, because there are extremes even on the sides that want to criticize what's happening in the name of gender ideology. You can take those criticisms and that call for safeguards too far. And so finding the right balance there, I think, is important. So Susie says these are Scientology tactics. And it's very true. When you listen to former Scientologists, they'll say when they start speaking up about the dark underbelly of the group, they start getting personal attacks, both verbal, online, as well as in person. And, so you can look at that type of response in Scientology and say, well, yeah, of course, it's because it's some weird cult. But when she says that there is a culty component of this, and it seems to be a state-sponsored cult, then it's because it's got that aura of cultiness that goes along with things like that Scientology. Now, the state-sponsored component of it, I think, is why we're here in the halls of this, state house. It's because, in some states, the state mandates that insurance covers these transitions, which are based on what she's seen as ideological, metaphysical claim about the human body and gender identity. And so the state is intersecting with these beliefs about gender in ways that are facilitating and positively reinforcing pathways that lead kids down transition. And that's why this debate is happening in the various state houses around the nation right now. All right, let's keep going.
Representative John.
Thank you, Madam Chair. Thank you, Ms. Brewer, for being here and for sharing your story. And I pray and hope that you are treated with much greater respect as you leave the halls of the Ohio State House today. So about a week ago, it was hit the news that a pretty famous singer by the name of Adele made a simple statement. And I'm not going to use all of her words because she was very passionate when she made this statement. And there's probably a lot that I don't agree with Adele on and a lot that I do agree. And this is a statement I agree with Adele. I love being a woman. And if I get quoted in the paper today, I'm probably going to get attacked for making that statement just as she did. I love being a woman. If we can't even make the statement that I love being a woman or I enjoy being a man in today's society, how in the world can we have conversations like this that are critical? It doesn't matter which side of the aisle you're on, which side you're on this topic. If we cannot make a simple statement like that without being attacked on social media, how can we have these kind of very important conversations? That's more of a statement than a question, and you've shared a lot about how you have been attacked. We talk about free speech. I find it interesting that on both sides of the aisle, we use that terminology when it's convenient for us. But then we are okay when we shut down free speech. So I guess I encourage you to continue speaking and thank you for being here. Sorry, it's not a question.
Thank you, Representative John.
Madam Chair, it kind of is a question, and that question of, if we can't even say I'm proud to be a woman, how can we have critical thinking about this? How can we really care for children who are traumatized, provide them the appropriate medical interventions when people are so scared? I had a therapist at the health department near where I live tell me he completely agrees with me, but if he says anything, he's going to be fired. That's intimidation, and that's not how we get the best care for our children. That's abusive behavior, it's bullying, and it's not how we should be legislating.
Are there any additional?
All right. So Erin does a masterful job again of taking a statement that seems to be just kind of calling out that there's, a dimension regardless of what's being discussed, there's a dimension of what can be discussed that seems to limit the debate. It seems to make it so that certain perspectives aren't even brought out onto the field to get a good hearing because there's this fear of being hated for something. And then she invokes, the statement, "I love being a woman," because if that statement, which seems benign and seems uncontroversial, if someone who makes that statement will be leapt on and attacked and criticized and demonized, well, then how can we talk about the very complex and controversial aspects of this, knowing that even something mild and like that will be a part of it? So Erin takes that statement and then says, we do need to understand that, because what you're pointing to is something where how can you be a critical thinker? And if you think about critical thinking, you should be able to entertain all different aspects, analyze different perspectives, and there should be no restraint on which perspectives you're allowed to question and to look at in order for you to consider yourself a critical thinker and saying, I've looked at every dimension of this, and after looking and reviewing the evidence and listening to different opinions, this is what I've come to. Well, you can't even get to that point if you're not allowed to hear certain opinions, because anyone who gives those opinions is demonized, and that has a cooling effect not only on the person who gave the statement, but on everyone who sees the consequences that happened to that person. And again, these are things that happen in cults, where when you see the one guy who stood up and questioned their leader get piled on, well, then it's less likely that you're going to stand up because you saw what happened to that person. So this is just pointing out that ideological, that culty component is really inhibiting the way that discourse is happening. And so if there's a main way of thinking about this thing, you have to realize that main way is occupying a space that is free of criticism. And that's why it's important to have these complex discussions, but you've got to kind of name and call out that dimension to the discourse to say, we need to have these discussions because they're not happening otherwise. Okay, let's see what goes next.
Questions for the witness? See none. Thank you very much for your testimony today. That will conclude the first hearing on House Bill 454.
Okay, so that was Erin's testimony before the committee there in Ohio considering the SAFE Act. Okay, so what I will do is we're going to try again to see if any of you guys want to give your perspective on what you saw. We're going to try this call-in feature again. If you want to call 210-422-2222, then we will see if we can get you on and you can share your perspective. I'm getting the phone system set up right now. I'm pretty sure it's going to work, but we'll have some patience in case we have the same technical issues we had last time. And in the meantime, let's take a look at some of our commentary from this. Okay. Susie comments on how Erin is so articulate. And, when I watched this the first time, your blood gets boiling a little bit when you see how dismissed she's initially treated by some of the people in the committee. But she just handles that so gracefully and refocuses every criticism on the issue at hand. And that is that, we're taking these kids, intervening in their lives based on what is essentially a religious type belief, something that's metaphysical, that speaks to a gendered soul, but it's intersecting with reality, and that the solution to the discomfort that comes from these beliefs and how people manifest in them is the solution is physical. It's surgery, it's hormones. And so we really need to pause and step back and say, do we want to have things that are metaphysical guide those types of interventions, particularly when it's targeted on kids who a significant number of them will turn out to be gay, and particularly when it's targeted to kids who are at the most plastic and fluid part of their lives where they're trying on different identities, and you don't want to seal a kid in a particular phase during that process because it forecloses them out of other possibilities and other ways of growing up. Okay, so again, if you want to share your perspective, you can call 210-422-2222. We would love to hear from you. Susie goes on to ask, if they're born in the wrong body, where is the right one? They should go to the hospital where they're born and ask them. And that whole, along with the gendered soul, this born in the wrong body narrative becomes a part of it. And that is another metaphysical belief, that there's some disconnect between whatever it is that we're calling the soul that has a gender to it and the physical body. And so you could just say, well, what do you mean that that's a metaphysical belief? Well, I mean, if you could look at just, any other religious form, I think the one that is the most comparable is the Heaven's Gate group. So there's a documentary on HBO Max called The Cult of Cults, and it's really fascinating. And we all remember the Heaven's Gate mass suicide incident where they went to this mansion in California and they found something like 39 bodies of people who committed a mass suicide. Well, this documentary is great because it goes back decades and it looks at the leader, it looks at the ideas that he was imposing upon their members. And one of the ideas was that their body was a vehicle for their soul. And their soul was something that transcended the human experience. And specifically, it transcended sexuality. And so the sexuality of their body, the gender of their body, was at odds with who they really were as this higher level of being soul that was going to graduate to the level above human. And so that idea affected how the members of the Heaven's Gate cult felt about their bodies. And it affected them so much that there was a period of time where they wanted to rid their bodies of the physical characteristics of sexuality to better align with who they believed that they were based on this soul that was ready for the existence above human. And so they attempted to castrate themselves. And it went wrong surgically, and they ended up having to go to the hospital. They went to Mexico at some point, and several of them had their genitalia removed in order to better align their body with this notion of what their soul represented, who they really were. And so that is a religious paradigm where you could say, yes, there's a bunch of false beliefs about a soul, about gender, and about the physical body and its sexual characteristics that so distorted somebody's conception of themselves that they felt that they had to physically mutilate and intervene upon their body in order to bring that better into alignment. And so you can look at that group and say, yeah, that's messed up. It's based on false beliefs. And those people, had they been allowed to live their lives and not have that type of intervention, may have reflected back on that and said, well, I'm glad I didn't do that because my thinking was distorted. My experience, my emotions, my sense of disconnect with my body was distorted based on those false beliefs. And now that I've learned more and I've grown beyond that, I'm glad I didn't take those irreversible steps then. Well, that is essentially how you can look at what is happening when you have these metaphysical beliefs about gender ideology intersect with our medical practice and then find its expression in the bodies of these children through hormones and surgery. And it's really scary because the question is, can ideas and beliefs that you internalize in your mind because of being exposed to them change your relationship with your body so that you want to alter aspects of your body to conform to those beliefs? And it's an interesting question to ponder, but it's really when you look at the Heaven's Gate cult and the experience of the people there that you realize, yes, these ideas are so powerful that if somebody internalizes them, then a set of beliefs could lead somebody to want to surgically alter their body. And I think that's a humbling experience, and it really should cause the mental health professionals to look at when people say there's a culty dimension to that, that's an important aspect to understand, because these beliefs can actually do this. Okay, so Martine Dietrich Smith, Dirk Smith says, you're being brave, John. I appreciate it. I'm agnostic in this regard, but I'm open to information and education. I've seen how you've suddenly been branded a hateful, ignorant bigot in the ex-Mormon community that used to love you. And I appreciate that note of support there. It is kind of interesting to see how even if you have been well regarded in a community, whether it's a professional community or something like that, those tables can change very quickly if you speak out of line. All right, it looks like we have a call. Hello, you're on Talk on Things and Stuff.
Do you think it is generally understood that a lot of children who have been sexually abused have some hatred towards their body?
Do I think it's generally understood that a lot of children who have been sexually abused have hatred towards their body? I think that when we hear stories of people who are now adults who used to be kids who reflect on their experience and are able to describe it in that way, I think we listen to that and we say, well, I can see how that makes a sort of sense. I think it's hard to really understand that unless you've been through it, but I think it's a reality that people have described about their experience that it can make sense. Understanding how kids may not be able to, frame their experience in any other way. And in terms of it being widely understood, I don't know that the extent of sexual abuse that happens in the world is widely understood. I think it's generally felt like the cases of abuse that we know about are a fraction of the total cases of abuse that happen. And I think there are probably people who go through that experience who don't have that particular way of framing it and don't respond in that way. So I don't know what percentage it is. I don't know if it's a majority of kids who have that or if it's a minority. What's your take on it?
My instinct is that cases are underreported, and if gender dysphoria is one of the warning signs of sexual abuse, or at least some sense of hostility towards one's own body, that is being picked up as gender dysphoria rather than as a warning sign for sexual abuse. Hence, perhaps not necessarily intended, but one of the effects of the focus on transgenderism in kids has been effectively covering up some of the child sexual abuse.
Yeah. I think listening to detransitioners who eventually come out, and it seems to be that is an experience that gets shared in a lot of these hearings, is that now that they're on the other end of the whole affirmation transition process, they say, hey, when I was a kid, I was abused. And when I went to a therapist, rather than address the abuse, they latched onto this affirmation paradigm and just went with it. And so that abuse and the trauma from it, the psychological effects of it, was never addressed. And that's a really important dimension of the recent documentary Affirmation Generation. And they talk about this effect where gender identity and gender dysphoria becomes the sole focus of the therapeutic process, and everything else is secondary. And it leads to untreated trauma, and as a result of that, untreated discomfort and issues in the person's lives. I think that I totally agree with what you're saying.
Here's the thing: you're a doctor, so I'm wondering, in conducting diagnosis, are doctors supposed to preserve certain elements that may be needed to conduct a second opinion?
Well, I think you're pointing to something that a lot of people have said is missing from this process, which is the formulation of a differential diagnosis. So if you have a paradigm such as the affirmation model of care, which says that if you have a child who experiences gender dysphoria, then the only right solution is to affirm. You must immediately affirm and then take all of those steps of social transition, hormone surgeries, and so forth. And then all of your therapy becomes centered on how can we facilitate that process. Well, that should be a red flag, because as a physician, when you are approached with a patient who has symptoms, there can be any number of complex underlying issues that lead to that expression of symptoms or that experience of symptoms. And you should be asking more questions to understand the landscape of the child's experience more. And then you formulate a differential diagnosis, which is that you have several different causes which could all feed into the experience that the child is having. And then we use what we've learned from past patient populations to try to order those causes by probability. And even when you start to do the interventions, you should revisit that differential diagnosis to see if the response to some of your initial interventions or the experience after that leads you to reflect and say, well, maybe we've gone down the wrong pathway. And because of how this is playing out in the intersection of medicine and this kind of ideological component, doctors are prevented from doing that. And I think there's some aspects of how this is manifesting in the medical community where you have doctors who have never studied gender or the treatment of it, and so they don't directly confront this. What they do is they refer patients to a gender clinic. And so then the patient is really going to be assessed initially by some psychologist or social worker who has got a list of things, but they already have gone through training with the idea that affirmation is the right way for anyone who experiences gender dysphoria. And there's a clip that I posted on my Twitter feed where part of the recent Q&A session in the Florida hearings interviewing Dr. Stephen Levine, who used to be affiliated with WPATH, he says, we've got a whole generation of mental health professionals who are coming through their education being indoctrinated with the idea that the only response to dysphoria should be affirmation. And so the entire profession of these young doctors is essentially brainwashed in that they've been given one solution to a very complex problem where in the past, mental health professionals would develop a differential diagnosis and they would explore many different aspects of it. So yeah, I think as a physician, there's something very wrong going on here, but it kind of takes a little bit of distance from the issue to be able to see it and to call it out.
Doctors are supposed to take statistics, but do you think that a lot of doctors are thinking about the psychological pitfalls in how statistics can be misinterpreted?
Well, I'm thinking back. So when I went through medical school, we didn't have a class in statistics. But the thing that I think is missing here that I'm seeing more and more now is that we used to have something called Journal Club. And so if you're a physician in training, then periodically there would be an article assigned and you were supposed to read through the article and you wanted to come up with something critical to say about the article. That's the focus on those journal clubs was not only understanding what a study, a publication said, but also understanding the limitations of that study or things that the study should have taken into account that they did not. And when you read medical literature and you read a study, there's usually a section of the study where the authors themselves have said, these are the shortcomings of our study. Our study didn't address completely X, Y, and Z. We were unable to account for, A, B, and C. And so the lazy resident might say, well, I'm just going to repeat what the authors themselves said were the limitations of their study. And I think what we're seeing now with this, the publications in this literature is that there's kind of a loss of the critical mindset towards medical literature and review. People have just trusted that the editorial boards and the peer review process of these journals is going to handle any of the deficiencies of these publications. And so we can just take the touted conclusions of the publication at their face value and run with it. And this is where we're seeing that if you look at the video that analyzes the American Academy of Pediatrics policy statement on transgender care, and you look at how they used citations which contradicted the conclusions that they were trying to put forward, because there's this loss of a critical analysis of how the medical evidence is supposed to work. So I think that hopefully what the medical profession will learn on reflecting of how this circle of trust of academic medicine and its intersection with where the rubber hits the road in the clinics is that people are going to reignite that need for critical analysis of what studies say. If you do have a study that's being touted, for example, a recent publication in, I think it's like Lancet or something like that, a trusted journal that says they had positive psychological output after surgical transition, but they only looked at like 18 months after transition. And you pair that with the track record in areas that have been doing this for decades, and they say that those experiences of regret and the negative consequences may not actually show up until 5-8 years later, and that's where the real difficulties start happening, and that's where that lack of long-term view of what's happening here is really, I think, going to come back and make many of the physicians who are intervening in this way regret that. But it's hard to regret what you're doing professionally if you believe that you're doing it for sound medical principles. It's a blind spot. Great questions. Any other thoughts on it? What's your background on all of this, or how did you get involved in this issue?
I'm a lawyer, and I was born under communism, so the dangers of pseudoscience leading to atrocities is rather dear to my heart.
Yeah, no, I hear you on that. Well, thank you so much for sharing a little bit of your perspective and your questions. These are great questions that I think people should really ponder as they consider this issue.
Here's my final question. Do you think that the general sense of optimism by people is contributing to a lack of due diligence?
I think there's a component of that. And I think it is a combination of optimism, meaning that they have trusted that their professional society and the various trusted journals have vetted the evidence behind these interventions well. And so they believe that it is sound medical intervention to positively affect the lives of the patients who are very dysphoric. And so you pair that sense of you're doing good for these patients with also the sense of I'm an ally. There's this theme of these people are oppressed and they're really in a bad way. Society has treated them very poorly, and I'm helping them. And so I'm a good person as a physician doing this, even in the face of people saying that what I'm doing might be hurting the patients. Well, by sticking even closer to my guns, I'm an even better person because I'm now, suffering my own criticism by these people who are showing up at these hearings, and I'm doing this. And you can see where that's taken to excess as physicians engage in the world of social media. I think the most popular one is a plastic surgeon on TikTok who has made yeet the teats as kind of a memeable thing, where she feels very glad that she can yeet the teats of young women who believe that their body would better align with their gendered soul if they had bilateral mastectomy. And so she feels like she's a champion for the downtrodden, a champion for the oppressed, because she's giving these surgical interventions that are being described as life-saving because there's this narrative about suicidality. And so there is this sense of goodness. They trust that it's the right intervention. They trust that they're good people for offering it to this marginalized class. And the more that they go out there, they see themselves as heroes in that narrative. And that's a dangerous place to be as a physician, because if you see yourself as as fulfilling some sort of hero role, then that is a bias which may obscure your thinking on this. It may distort your thinking about the evidence, about the effects. And that's a real thing. I think that as surgeons or physicians, you have a strong bias to believe your own goodness and the rightness. And I think this manifests to me most clearly when I was in training as a radiologist. I had a surgeon come down and ask me to look at a post-operative CT scan on a patient because people were saying that his anastomosis, where he had connected the bowel back together, was leaking. And so I pulled up the scan, and it was not subtle. It was like obvious. There was stool and gas in the peritoneal cavity. But the surgeon would not believe it. He insisted that it was something else. And it was just this, I was like, no, this is not subtle. This is very, very clearly a perforation. But because the surgeon himself had done it, it's harder to see deficiencies in your own work. And that's why, you don't treat family members. You're like, there's an inherent bias that we all have towards our own things that we're involved in that make it harder to see it. And that's why third-party perspectives, that's why testimony by people who maybe aren't directly involved with the present day discourse, like Erin here, but have their own experience that can bring to it, may be important. So that's my take on that.
Well, thank you. Good day.
All right. Thanks for your call. That was great questions. Okay, so let's see here. I think we have another call. Hello, you're on Talk on Things and Stuff.
Hi, Jonathan. I'm a long-term listener from England. I've listened way since back when you were focusing on Mormonism. So it's a pleasure to speak with you.
Well, thanks for coming on that journey with me.
Yeah, it's been quite a journey. I'm just wondering, looking at the similarities between these two ideas, both of them seem to have a lot to do with like a subjective feeling inside, meaning that something is true. I'm wondering, in your journey, what similarities have you found between those two ideas?
Well, I think that that sense of feeling that something is true calls to mind immediately. There's a TED talk talking about something like how do you know how does it feel to be wrong about something? And the answer is it feels exactly the same as it feels to be right about something, because you don't know that you're wrong about something in the moment that you're expressing it or feeling it. It's only when you're confronted with contradictory evidence that you have to deal with that feeling. And so in the world of religious ideology, we frequently talk about cognitive dissonance, which is this sense that you get when you encounter evidence or ideas that contradict what you believe to be true. And there's a kind of a anxiety, a sense of disconnectedness that comes as you try to rationalize or find a way to make those things fit, and you can't. And so that's where a bit of humility about what you believe to be true is important. And it's hard to achieve when you have this moral vector about what it means to be a good person, both in the religious realm as well as on this issue of gender identity. Because we have a strong sense that there's a good way, a right way to think about these things. At least that idea is out there. And so it's harder to come to terms with it. But I think it just, it can feel the same way. And that's, for me, why watching cult documentaries, listening to detransitioners, listening to people who have gone through that journey where they felt a certain way, and then later they learned things that gave them a reason to reconsider their experience, to reframe and understand their experience from a different view so that they could see that there was something totally different at play going on. It's harder, I think, because I went through that myself, being born in the church and then gradually learning information that could not make sense. And it was only when I stepped outside of the information milieu in the church that I was able to make sense of what I had experienced, because I could see how those thoughts were distorted in other ways of thinking. Now, on this issue of gender dysphoria, myself and many people who have opinions on this, including the physicians who are treating these patients, have never experienced the gender dysphoria in the way that these patients have. And so I think that disconnect means, well, I haven't experienced it, but these patients have. Their distress is real, so we need to take them at their face value, and that can feed into the listen to the kids and take their lead on it narrative of it. But as physicians, we're supposed to not be guided solely by the demands of patients. There's a reason that we're trusted to have an understanding of the evidence, of the ethics, of the potential outcomes and the options that our patients have, and guide them in the choices that they make. And that's a responsibility and a trust. And if the paradigm that you have is whatever the patient wants is what we do, then they're taking that professional obligation of the physician outside of the picture, and the physicians just become a rubber stamp, and they become a facilitator rather than an expert professional helping patients at their most vulnerable moments. And so I think that's a dimension to this that is difficult to confront. How do you pull a physician out of that mindset? And for me, when I first encountered this issue, I did not experience it, but I had things in my life, people in my life go through some of these experiences that when I first decided to study about this, it was because, well, I want to understand better. I want to be able to support the people in my life who are experiencing this, so I want to understand more about it. And I read, and I started listening to people, and I started seeing the same red flags of groupthink, of demonizing dissent. All the things that I've talked about in cult dynamics in the religious realm are happening in this social media realm. And that caused me to really pause. And then I started to look at the medical evidence, and I started to see that some of those distorting groupthink type effects have affected how the medical community discusses, publishes, conducts research on this. And it just set red flags everywhere. And that's where, even though I haven't experienced it, I felt like there's a dimension to this that needed to be talked about, and it's easier for me to look at this from a medical perspective and dealing with children, because I think that's where the most critical discussions happen. If you're an adult and you see yourself as occupying a different gender and you want to inhabit your life in a different gender, well, then you have reached the stage where you can consider different perspectives on this and make a decision for yourself, and more power to you in that regard. Adults can also have their thoughts distorted, as we learned with the Heaven's Gate documentary. And so the mere fact of being adult doesn't mean that you could not internalize false beliefs that lead you to make decisions about your body that you might not later regret, or that you might later regret. So that's still a reality, but at some point we allow people to live their lives. And so it's just this question of kids that comes into it. Anyway, that's a long rant in response to your talk prompt. What's your perspective on this? I know it's, as you've come with me on this journey, have you, I don't expect people to just accept what I say and to believe as I do. So, I certainly am interested in any other perspectives that you bring to it.
Yeah, well, I think I see similarities, I think, in the way that Brigham Young would treat apostates, saying that it's better that they're silenced, to put it nicely.
Yeah.
And I think that there is certainly some of that of saying, well, the other side, their only motive is bad, that they are evil. That's the only reason that they're opposing our wonderful, wonderful views. It must be that they're evil inherently, and it's just kind of crazy to see these similarities. It's like humans have this in them.
Yes, no, absolutely. That's where I started out this religious journey. I'm like, oh, it's just these religions. They have these distorted ideas. They demonize people. It's all because of religion. As soon as you claim God is speaking for you, you can do all these things. And then you step out and you realize, wait a second, this is happening in the political realm. And this is happening in families. And this is happening and what you said, this is a human experience. And the way I've started to conceptualize it is that we have human vulnerabilities, human psychological vulnerabilities that can be kind of seen as levers that then these forces start to interact with us at. And they could be something as much as simple as a need for belonging, a need for meaning, and a need for purpose, a need for community. All of those things are vulnerabilities that we have because they're areas where our need for those things can be exploited by people who offer them, but then have a bunch of other baggage that goes along with it. And it's really by understanding that paradigm that you can start to at least hold your distance a little bit from communities and movements that you may get involved in that, you don't want to go too far down those pathways. I love what you said, though, in terms of like the similarities with Brigham Young's. And that was like one of the first things is that if you criticize this, you are a bad person and you must be shunned, and what they're calling cancel culture. Like that is like, hold on a second there. I've been in an environment like that and it was not good. And it caused me to hold on to false beliefs. And you run to the ex-Mormon community and you're like, hey, you guys, look at all this culty stuff that's happening there. And then they bring out the torches and the pitchforks and start aiming them at you. And you're like, hold on, wait a second. The call is coming from inside the house.
We would never do that.
Yeah.
To prove it, we'll do it.
Yeah, but I think there's an impulse on both sides, though, because even from somebody who's critical of some of how this is playing out, you can go too far in the other way. And I could start to see anyone who is trying to promote affirmation as a predator or a child abuser or as somebody, and I don't think that's the case. I think that there's a way of understanding how people on both sides of this issue really are trying to do what they believe to be good. It's just that we need to sort through those beliefs and figure out which ones have evidence behind them, which of them are verifiable, which of them are true, and which of them we can then ethically apply to this vulnerable population of kids who are really trusting us as adults to help them get through adolescence into adulthood without irreversible harm so that they can, live to their full potential as adults.
I see what you're saying. I have a slightly more nuanced approach because I don't think, what's the way to say it? I was surprised when I found out in 2020 that the leader of the LDS Church actually believed what he preached, because he was telling people twice that they should fast to make COVID go away.
Yeah.
And as someone who was tracking the numbers closely, I noticed that he was always doing it before the spike. So as the numbers were increasing, you could tell anyone with a calculator could figure this stuff out. He should, if I thought there's no way that he can be a false prophet, well, that he can be lying, because he must genuinely believe that he can do something. Obviously, it didn't work. Yeah. Because anyone who was a deliberate, knowing false prophet would have just waited until the epidemiologist explained where the peak's going to be, and they would just say, right, okay, we have to pray that day. Great, okay, but we'll pray on that day. We'll see the results. Instead, he was getting it all mixed up, and he was just praying at the wrong times, and it wasn't working. Yeah. And I just thought, this proves that he genuinely believes it. Oh my goodness, that's a surprise. And so I think in that ideology, and I think in most ideologies, there are certain people who genuinely believe it, and other people, I think, you look at some of them and you think, I don't think that they really do believe it. I think it's just convenient for them. Their job depends on it, or their family depends on them, having this view. And so it's an interesting one. I think that there are some who are sincere but misled. But even then, you've got to say, well, if you can explain to them where the problems are, if they then look at it and go, I believe that those problems are legitimate, but I don't care to change, then I think it's like, what about those who look at it and then they'll say, I don't believe that those problems are real, even when there's people stood before them saying, yes, this is a real thing, So it's an interesting one, really. There's a lot of nuance. People are complicated. We're all very complicated.
Well, and that's kind of one of those things where people say, if you've achieved your position through logic, reason, evidence, and rationality, then bringing up contrary evidence that refutes your prior beliefs may be effective. But if you have achieved your position based on emotion, based on meaning, based on things that are not objective reality, then those objective arguments don't actually hold the weight that you might think that they do in terms of changing your perspective. And that's where, believing that you are a hero and that you are, somehow there's a moral component to what you do in and of itself can lead to that type of bias that makes it harder to be objective about the evidence and the outcomes.
Yeah, that's one thing that reminds me of like what I've seen in, I'm sad to say I've seen in humans is the more that they think they're the right ones who are doing the right thing, the more harm that they're capable of doing, because we have to get this utopia. We have to. It doesn't matter if we crack a few eggs to make an omelet. It's got to be done.
And on that note, there's this great podcast that's coming out called The Witch Trials of J.K. Rowling, and she plays a role in the discourse over this issue, certainly online. And in the second episode in particular, I mean, I cannot recommend the series highly enough so far, but in the second episode, near the end, she talks about that very thing where when you tie a sense of righteousness to what you're doing, it can feel very intoxicating and very euphoric to go on that crusade, but you just have to realize that is the moment most where you need to check yourself. And you need to push back against that impulse and make sure that what you're doing is the right thing, because it's the hardest moment to find yourself doing the right thing. And she tried to infuse that theme into the books. And that's part of that type of morality tale is something that really appeals to me. And that's part of why I really love those books. And I continue every time I encounter J.K. Rowling and kind of her ideas and her ethics and morality that go into that, I continue to be impressed by her. But
yeah.
All right. Well, thank you so much for your call. Well, definitely check it out. It's called The Witch Trials of J.K. Rowling, and it's a great listen. And it's actually hosted by a woman who was raised in the Westboro Baptist Church, which here in the States is one of the most vocal cult-like. These are the people that would hold up. They would go and protest gay people's funerals, and they were the most vocal, critical people. And she was in that growing up and escaped that as a controlling religious environment, and now is looking at this issue. So it's really fun to see that perspective.
Very interesting. Do you think that cults can be non-religious, or non-religious bodies can be cults? Because I think that the overlap is just so great in some of them.
Mm-hmm. Yeah. I think it's wrong to see cults only as religious entities. And that's where that word cult becomes a problem again, because it kind of boxes you into thinking about that thing. And so if somebody rather than using the word cult says a high demand group or a totalistic group, or a coercive controlling group. I think that's a different way to conceptualize these things that may open your mind to see these things as potentially happening. And you could say, okay, well, you can watch the documentary on the flat earthers and say, okay, there's those dimensions that are there. You can look at people who have adopted certain political radical movements and say, okay, well, that definitely exists there. You can study history and you can look at things like the Chinese Communist Revolution, the Russian Revolution, and you could say, oh, these same dynamics are happening in a very political, a-religious realm. And you can even see coercive, manipulative family groups where there's, a figure that is leading it all, and it happens there. For me, the harder thing to conceptualize is that we think of these groups as having a strong, dynamic, charismatic leader or an imposing leader, one single figure. And so you would look to the prophet, or you would look to Chairman Mao, or you would look to some, strong individual leader. It's harder to conceptualize that type of dynamic happening centered around an ideology or an identity that doesn't have a single figure at its head. But I think that this is something where, rather than a cult of personality centered around one individual, we have a cult of identity or a cult of ideology, where it's this system of beliefs and this identity that goes along with it that operates in the realm of social media without even requiring people to physically be together, that still preys upon people's need for community, people's sense of goodness, and has the same sort of consequences of, demonizing apostates and everything else that we would find in those groups. It doesn't have a central leader. And so it may be a blind spot in looking at these things.
That is so interesting, because that's just made me think about something I've never really thought about before, which is like when people feel pressure to have nice things, materialistic goals. I just thought, hold on, they kind of reject those. It's like piety. The higher you get, the more you buy, and it's like, interesting. I don't know.
Well, I think just take any vector of goodness, whatever you think to be good, and then just elevate the importance of that goodness. And I think you're going to start to see all of these social things happen, just because we're human creatures that seem to have some similar psychological landscapes that meet together in group dynamics like that. Well, thank you so much for your call.
Very interesting.
Yeah, great discussion.
Yeah, thanks for talking.
All right, take care.
Bye.
No. Okay. All right. Well, we've gone about an hour and a half, a little bit over that. I think that's a great discussion around that. We will come back again soon and take a look at the next testimony in the Ohio SAFE Act hearings. We're going to love to hear more from Representative Liston, and there's another representative that will chime in later that also has the effect of making the temperature in the room rise a little bit, but a bunch of other great witnesses coming up as well. So tune in, and if you get a chance, hit the like and subscribe button on this video just to allow it to kind of float up the algorithm, and maybe more people will catch on and join us for future conversations. So until next time then, this has been Talk on Things and Stuff. Take care.